Your Elastomeric infusion pump is designed for easy at-home use. Wherever you're at in the infusion learning process, remember, you're never alone. Roswell Park staff are available 24/7 for advice and encouragement. Call 716-845-2300 and call center staff will route you to a specialist who can help you. Also, you can access patient education materials online through the Roswell Park patient portal by searching the keyword Elastomeric. We've created this video for folks who have already been set up with their infusion pump in the infusion center. We'll go over how to flush and disconnect your pump, which happens once your infusion is complete, and how to deaccess your Metaport. We hope this guide empowers you to use your Elastomeric pump with confidence.
Come in.
Hey, Jake.
Hey, Shantoya.
How's it going with your infusion pump?
You know, it's going well. I think I'm getting more used to it, and I think it might be done.
Yeah, I can see that. The ball looks completely contracted. I see the wrinkles, so that's how we know it's done. Why don't we go ahead and teach you how to deaccess the pump?
That sounds great.
All right, let's do this. So when you get set up, you want to get a nice clean flat surface, and you're going to want to get your supplies set up. Gauze pads, alcohol pads, Band-Aids, pre-filled saline syringes, and non-sterile gloves. You'll also need a sharps container for everything at the end.
Beautiful.
Okay, so when you're picking out your surface, you want to pick out a clean surface like a dining room table or an uncluttered desk, and you can wipe it down if you need to. We only ask that you avoid the bathroom, as bathroom surfaces tend to be less clean. When you're deaccessing your pump, you want to start by washing your hands with soap and water or an alcohol-based hand sanitizer. And after sanitizing your hands, you want to put on your non-sterile gloves. Next, you want to get your supplies ready. So you can open up your gauze pad and lay it on a nice clean flat surface. Now open up your alcohol pads, one of them. And you can also lay those right on the surface, as well as your Band-Aid. You can just open that and let it lay to the side. Great. Now you want to get your syringe ready. You want to open it up, and with the white tip facing up, you want to loosen the cap just a little. Great. You're going to pull back on that plunger just so you feel it stop, and push forward until you get the air bubble out. Yes, right there. And now you can lay it off to the side and leave the cap loose.
All right, I've got my gauze pad, my alcohol pad, my Band-Aid, and my pre-filled syringe. I've got my hands washed and my gloves on. I think we're ready to move on.
Yeah, you've got this. So now we're going to move on to flushing your port. You're going to start by unbuttoning your buttons on your shirt. Great. You can see your port, and now you want to close the white clamp on the pump tubing, and you should hear that click and lock in place. Now, coming up the line, you want to remove the tape over the flow controller. Now you want to close the yellow clamp closest to the pump.
The yellow clamp closest to the pump.
Yes.
This one, right?
Yes. The yellow clamp closest to you and your port, you're going to leave open.
This one, not that one, right?
Correct. Now you're holding the connector with your non-dominant hand. You're going to take your dominant hand and unscrew the green cap and lay it off to the side. Now you're going to take your alcohol pads and scrub the connector thoroughly for 15 seconds. Great, and now you want to let it dry for 15 seconds. Then you want to grab your pre-filled saline syringe with your dominant hand and using your non-dominant hand to assist you in holding the syringe, you're going to unscrew the white cap with your dominant hand.
Like this?
Yep, there, and lay it off to the side. And grabbing the flush back into your dominant hand, you're going to line the tip of the flush back up with the connector and push and lock it in place, turning clockwise. Great. Now that you have the plunger in your hand, you're going to flush a third of the saline solution in over 20 seconds. And you want to stop. And then you want to push another third of it over 20 seconds. And stop. And then the last third you want to push all the way in, again over 20 seconds. In total, you should be flushing for about 60 seconds. Okay, now that your syringe is empty, you're going to leave it in place.
So 3 pushes with starts and stops, and then I leave the syringe connected.
Nice job. So now that all the clamps are closed, you want to close out the clamp closest to you.
Closing out the last clamp.
And that should also click and lock in place. So now that all the clamps are closed, we're going to move on to the next step, which is removing the needle from your port. First, you're going to gently peel the dressing off of your skin and gently pull it back off of the port. Great. Next, using your non-dominant hand, you're going to apply pressure to the base of the port. And with your dominant hand, you're going to pull back on the textured handle of the port until you hear a click and it locks in the safety position. It's like pulling a tab up on a can of soda, but it's not as much resistance.
Okay, so I'm right-handed. So with my left hand, I'm going to hold the base firmly against my skin.
Yes. And with your dominant hand, pull back on the textured handle until you hear a click.
There's the click.
That's it. That click tells you the needle is locked in the safety position. We have you use your dominant hand because you generally have more control over it.
Got it. I didn't feel anything when the needle came out. Should I have?
You may feel something move slightly, and you'll feel the pressure you're applying, but you shouldn't feel any pain. Now that you've heard the click, your hands are free, and you can set down your needle. Now, take your gauze pad and apply pressure for 3 minutes where the needle was.
Apply pressure for a full 3 minutes?
Yeah, we want to make sure any bleeding is stopped. Okay, after waiting 3 minutes, you can take your Band-Aid and apply it over the area. And that's it. Congratulations, you did it.
Thanks, Shantoya. That wasn't so bad.
No, it wasn't, but there is one more part, the cleanup.
Of course.
Now that we're at the cleanup, you're going to separate the port needle from the tubing by twisting it apart. And once you have it twisted apart, you'll set it aside. We'll put it in a sharps container. All of your other supplies, your used elastomeric pump, your gauze, your flushes, will all go in the trash. And for the trash, I bought this bag. Perfect. And your gloves. Great. I'll close this up and we'll put it in the garbage can. That takes care of the trash. Now for the needle, you'll dispose of that in a sharps container, but you don't throw that in your garbage. You bring it back to Roswell and you place it in a disposal box located on the first floor by the ATM in the main hospital. And with that, we're done.
It's not so bad. I might need to revisit a few steps, but I think I got it.
And when you get home, if you feel like you still need extra help, Roswell Park staff are available to you 24/7. And if you really want to own the process, try teaching it to someone you know. See one, do one, teach one. It's a great approach to achieving mastery over something.
You know what? That's a really great point. I have a friend who's been offering to come over and give me help, and I think I'm going to give him a call. Thanks, Shantoya.
You're welcome. And here's a guide to take home with you.
Thank you so much.
You're welcome. My pleasure.
When taken care of, your infusion pump system will take care of you. It'll reliably deliver your medication where and when you need it. With a little practice, using your pump will become second nature to you. Revisit this video if you're unsure about a certain step, and if you need further support or guidance, we're here for you. Thanks for watching.